So today's topics will include Medigap, Medicare coverage choices, including Medicare drug coverage, Part D, Medicare Advantage plans. We'll also talk about coordination of benefits, and we'll wrap things up with an overview on fraud. So in our day one session yesterday, we learned about original Medicare. We went through what Part A is, what Part B is, but unfortunately, due to technical complications, we didn't get to cover our Medigap section, which works with original Medicare. So just kind of as a little refresher, just wanted to remember that this relates back to Medicare Part A and Part B, which we call our original Medicare pieces. And then we'll go into later on today, drug coverage, Part D, and Medicare Advantage plans as well. So when you first enroll in Medicare and throughout certain times of the year, we talked about the different enrollment periods where you can change your Medicare coverage to what fits best for your situation. There's really two main ways to get Medicare. There's original Medicare, which we had discussed yesterday, and then there's Medicare Advantage, which we're going to go into detail today. If you have original Medicare, meaning that you have Part A and Part B, then you can also choose to buy a Medicare supplement insurance. Sometimes this is called Medigap policy, and they help cover some of the out-of-pocket costs associated with original Medicare. So let's take a closer look at this original Medicare coverage options box, if you will. So if we were to enlarge that box on the previous screen, it would kind of drill down to something that looks like this. For original Medicare, you have Part A, which we talked about yesterday, is really your hospital services, right? Inpatient hospital coverage, along with skilled nursing facility coverage, hospice care, and home health care. You also have Part B, which is medical insurance, right? We talked about the outpatient services and preventive services that are covered under Part A, and we went into the different costs that Part A and Part B both have. Deductibles before you use service. For Part A, it can be deductible based off of your benefit period. For Part B, it's the yearly calendar deductible. There's also co-insurance for certain services when you use covered services under Part A and Part B. So Medicare does cover a lot, but there are out-of-pocket costs associated with getting care for the services that are covered under Part A and Part B. If you decided that you needed prescription drug coverage or help covering prescription drugs, and you had original Medicare, you could choose to add what we call Part B, which is Medicare drug coverage. So we are going to go into detail about what that drug coverage looks like later on today. But that last box that you see on your screen where it says you can also add supplemental coverage, that's where I want you really to focus in on right now. So some people might already have existing coverage that can supplement or work with their Medicare coverage. For example, if they've retired and have retirement coverage through their previous employer, or maybe union coverage. So that can work with Medicare and help pay for some of those out-of-pocket costs. So depending on your situation, one payer would pay first, and then your other supplemental coverage could cover some of those out-of-pocket costs. But if you don't have another source of supplemental coverage, then you might want to consider purchasing what we call a Medigap policy. Okay, and so Medigap policies are sold by private insurance companies. And as the name implies, they're meant to fill in what we call the gaps in original Medicare coverage. So again, we come back to some of those out-of-pocket costs that we focused on yesterday for Part B and Part A, the deductible costs, the co-insurance, and the co-payment. So if you recall, for Part B, we talked about Medicare normally pays about 80% of a Part B covered service, but then you have the remaining 20% that you would be paying out of pocket. If you had an inpatient hospital stay and you had Medicare Part A, then the first $1,556 is the deductible for that inpatient hospital stay per benefit period. So these are some of the costs that a Medigap policy, if you choose to purchase one, could cover in the event that you're using these services. Now, each Medigap policy is standardized under a plan with the same letter. So they have to follow federal and state laws that are designed to protect you. And all Medigap policies have to be clearly identified as Medicare supplement insurance plans. So the Medigap plans are standardized in a way, they're using
letters, excuse me. So there's plans A as an apple through N as in Nancy. Right, so whether each company that has a plan A must offer the same basic benefits, no matter what insurance company sells it. So a plan A is the same plan A that you might get from one carrier, and when you go to the next carrier and they're carrying a plan A, it's going to cover the same benefits. The only thing that might vary are the costs of what it's going to charge you for that plan A policy. Okay. The last bullet on your slide there are what we call sometimes as waiver states. They select their Medigap plans in a different way. And in some states also there's what they call Medicare Select. And Medicare Select are standardized plans that may require you to see certain providers and may cost less than other Medigap plans. So just be aware of those terms and some of these exceptions for the states that you see on your screen, which is Minnesota, Massachusetts, and Wisconsin. Now, all Medigap policies are required to cover these basic benefits. So no matter the letter, we just talked about the standardization of letters, and we'll see a chart in just a moment that really breaks that down a little bit more clearly for you. But no matter the letter, all Medigap policies must cover these services that you see on your screen now. So the Medicare Part A coinsurance and hospital costs, we went over that yesterday. So we said coinsurance after hospital costs for 2022, and those rates are updated every calendar year. So it's important that you check back and use the hyperlinks that are in your notes to get the most current figures. But the Part A coinsurance hospital cost for 2022 for days 61 through 90 would be $389 a day. So this is a required basic benefit for a Medigap policy. So somebody that had Medicare Part A and a Medigap policy, in the event that they are hospitalized, this is where their Medigap policy would come in and pay that cost as opposed to them having to pay it out of pocket. And so the same goes for the Part A hospice care for the coinsurance or the copayment, blood for the first 3 pints, and Medicare Part B coinsurance or copayment, which we talked about yesterday, is generally about 20% of the doctor's bill. Okay. Now, companies can charge different premium amounts for Medigap policies, and we want to explore a little bit about your Medigap costs. You know, what are the things that are impacting what an insurance company is going to charge you for the exact same coverage? So costs can depend on whether medical underwriting is used, meaning the company has reviewed your medical history and decides whether or not to accept your application, or can apply a different premium amount, a different price, essentially. It can also depend if it's a Medicare Select policy, like we just talked about on the previous slide quickly, that some states have Medicare Select policies, which can be less expensive than standard Medigap policies. So it depends on the state. It can also depend in terms of your pricing of whether or not you're in your Medigap open enrollment period when you purchase your Medigap policy. And generally that's when you're going to get the best price. And we're going to go into that in detail. We have a video in just a moment to explain the Medigap open enrollment period, but it is the best time to enroll, and that is when somebody would get a lower cost than otherwise. It can depend on where you live, the zip code, whether you're in a rural or urban area. Insurance companies look at all these things to determine what your premium is going to be for your Medigap policy. In your age, and then in some states, you can be age rated or under 65. And then lastly, it can depend on the company, what they want to charge for that policy or plan. And that's again, making sure that you're shopping by letter, because a plan A is going to be the same plan A regardless of which company, but companies have the right to charge their prices. Okay. So here is a list of all the Medigap policies that are out there. And again, they're standardized by these letters. So this A through B, or A through N, excuse me, across the top of your slide in the, I'll say the darker blue. And the first, if you look at the benefits column, the first 4 rows are those required covered services that we talked about a couple slides ago, right? Those are the services that every Medigap policy is going to cover. And so you can see that the first 4 rows all the way across have coverage percentages in them. Okay, now the coverage percentages can vary. You can see that Plan K, for example, covers it only at 50% for the Medicare Part B coinsurance component. So this is how you're reading this chart, is the percentages based off of the benefits. All right. And as you move down, you can see that for the skilled nursing facility coinsurance, a Plan A is not going to cover that. If that's something that's important to somebody who's shopping for Medigap policies, then they would look elsewhere at a Plan C, D, and so on and so forth. Right? It's important to note, again, there have out-of-pocket limits that are set, and this number is updated yearly for Plans K and L. You can see some of the notes that are on your slide, that there are also some changes and differences in different states. So a lot of when you're shopping for Medigap policies can start with your state Department of Insurance, because they'll have the best information for the plans that are offered in your state. Okay, and there's also, with a change, you can no longer buy Plans C and F if you are new to Medicare on or after 2020. So that those plans have been phased out for anybody new to Medicare. Now, if you had one previously, as long as you continue to make those payments, you are allowed to keep your plan. And so now let's take a closer look at what we meant by the Medigap open enrollment period, in which you can get the best price guarantee when you're shopping for your plan.
The best time to buy Medicare supplement insurance or a Medigap policy is during your 6-month Medigap open enrollment period, or OEP. Your Medigap OEP begins automatically when you're 65 or older and enrolled in Medicare Part B. During your Medigap OEP, you have the right to buy any Medigap policy sold in your state for the best available price. There are other limited situations where you may be able to buy a Medigap policy, which is known as your guaranteed issue right. In most cases, you have a guaranteed issued right when you have certain types of other healthcare coverage that changes in some way, like when you lose the other healthcare coverage. When you have a guaranteed issue right, an insurance company must sell you a Medigap policy, must cover all your pre-existing health conditions, and can't charge you more for a Medigap policy because of past or present health problems. In most cases, you can buy the Medigap policy up to 60 days before, but no later than 63 days after your MA or PACE plan ends, the date on the notice you get telling you that your coverage is ending, or the date on a claim denial. You should keep any paperwork, emails, or claim denials that have your name on them as proof of your coverage being terminated to prove you qualify for a guaranteed issue right. Then you won't need to answer medical questions. Some states may provide additional Medigap rights, so be sure to talk to your state Department of Insurance or your local state health insurance assistance program, or SHIP. Here's Patricia. She's turning 65 and still working, and she is covered by her employer group health plan. She plans to enroll in Part A now and enroll in Part B later because she still has employer coverage. This allows Patricia to delay her Part B enrollment until her employer group health plan coverage ends or she retires, whichever comes first. She's not getting Social Security or Railroad Retirement Board benefits yet. Because Patricia is delaying her Part B coverage, the start of her Medigap OEP is delayed too. Remember, for her Medigap OEP to start, she must be both 65 or older and enrolled in Part B. Once Patricia enrolls in Part B, her Medigap OEP begins. She won't have a delay in her Medigap coverage as long as she buys a Medigap policy during her Medigap OEP, even if she has a pre-existing condition. This is because she kept employer-sponsored group health coverage while delaying Part B, with no break in coverage for more than 63 days. What happens if Patricia misses her Medigap OEP? Patricia may have other opportunities to buy a Medigap policy. However, her timing is critical. The insurance company can deny coverage or charge her more if she misses her Medigap OEP, and she doesn't qualify for a guaranteed issue right, or her state doesn't have additional rights and protections. It's important for Patricia to understand that after her Medigap OEP ends, there's no guarantee that an insurance company will sell her a policy. Some states may have more generous rules. It's best that Patricia talks to her state insurance department or local state health insurance assistance program, also known as a SHIP, for more information about her Medigap OEP. If Patricia is able to keep her employer group health plan after she retires and the plan ends, she'll have a Medigap guaranteed issue right. She'll need to keep the notification that her coverage has ended to show that she has a guaranteed issue right to buy a Medigap policy. Generally, if she misses the time that her guaranteed issue right covers, she may still be able to buy a Medigap policy whenever an insurance company is willing to sell her one. However, the insurance company may charge her more, and it may delay or deny coverage for pre-existing health conditions. When you talk to Patricia, make sure she understands why the timing of her Medigap OEP is important.
I think it does a good job of explaining what a Medigap open enrollment period is. But just to recap, the Medigap open enrollment period begins the month that you're 65 and older and you're enrolled in Part B. Now, in order to buy a Medigap policy, you have to have both Part A and Part B. But you can have Medicare Part A, for example, maybe you're still working, and delay your Part B enrollment till after you retire and are no longer covered by your employer group coverage. Then once you pick up your Part B, now you have 6 months to pick your Medigap policy. And in that 6 months, that's your Medigap open enrollment period. During that time, you have federal protections where companies can't refuse to sell you any Medigap policy they offer. They can't make you wait for coverage or evaluate any pre-existing conditions when they're looking for your medical history. And they can't charge you more because of a past or present health problem. So this is why, because you have these federal protections, this is why the Medigap open enrollment period is really the best time for you to buy a Medigap policy, because you'll get the best price. And we're talking about federal protections here, but sometimes states offer additional protections. So it could depend which state you reside in. So you might have even longer than 6 months, but 6 months is the minimum. And again, your state might have additional protections. So it's really important that you talk with your local state health insurance assistance program, or SHIP, and the State Department of Insurance. They're great local resources that can let you know the state-specific policies and coverage. Now, outside of your Medigap open enrollment period, so if that 6 months has concluded and you didn't purchase the policy and you're not in a state where it has a longer or additional protection, you can still buy a Medigap policy if there is a company that's willing to sell you one. You still get the coverage from the policy that you choose to buy. You might just have a waiting period, or you might be being charged more than you would if you had enrolled during your Medigap open enrollment period. And with that, we're going to move to a check your knowledge question, and I'm going to turn things back over to Carrie.
Okay, thanks, Kim. So let's check our knowledge about some of the things that Kim was just presenting on about Medigap. The friendly representative on the phone, and we're going to we have a timer at the bottom, and I just wanted to point that out because we also allow our materials to be used for training purposes if you do training, and feel free to use that feature. The friendly representative on the phone tells you that you can't buy a Medigap policy from her company to supplement original Medicare because you have Medicare due to a disability and aren't 65 yet. Is she right? So you can actually choose 1, no, Medigap is available to anyone with Medicare, or 2, it depends on which state you live in. People thought 1, some people thought 2, and the answer is 2, as we have circled there. It depends on what state you live in. Federal law doesn't require insurance companies to sell Medigap policies to people under 65. If you're under 65, you might not be able to buy the Medigap policy you want, or any Medigap policy, until you turn 65. Some states require Medigap insurance companies to sell you a Medigap policy, even if you're under 65. So what that's saying is, check with your state. And it depends on what their rulings are as far as that goes. Okay.
All right. Thanks so much, Carrie. Okay, we're going to dive right into the table of contents here and learn more about prescription drug coverage, Medicare Advantage. We'll take a break and learn more about coordination of benefits, Medicare fraud, and look at some resources that can help you with CMS program-related resources. All right, let's go ahead and get started here. Now, when we talk about Medicare prescription drug coverage, really what we're looking at here is an optional benefit for those that are part of the Medicare program. Again, it's run by private companies that contract with Medicare, and they offer prescription drug coverage in a couple of different ways. You can get a standalone Medicare drug plan that works with original Medicare. So that means if I have original Medicare fee for service and I would like to add drug coverage, I would get a Medicare drug plan. If I'm interested in a managed care option looking at a Medicare Advantage plan, then I could get a Medicare Advantage plan with drug coverage in order to get Medicare drug coverage. We also have some other things like Medicare cost plans that offer drug coverage as well. But again, it's an optional benefit for those a part of the Medicare program. When we think about the Medicare drug costs, really you want to consider some key things. When looking at a Medicare drug plan, you want to consider the monthly premium because it can vary by the plan and as well as your income if you qualify for some assistance. There could be a yearly deductible. And looking at the cost of your prescriptions, whether there's co-payments or co-insurance. Now, most people will pay a monthly premium for Medicare drug coverage, but you also will pay a share for your drugs, including a deductible, co-payment, and co-insurance. Now, a percentage of the cost while you're in a coverage gap, there's an initial coverage limit when looking at Medicare prescription drug coverage. There is also a coverage gap. But again, Medicare will still cover 25%, 75%, and you pay 25% for your prescription drug costs. But then we also have, once you and your plan have spent $4,430 for covered drugs, you are now in known as the coverage gap. And that gap is temporarily limit on what the drug will cover in that class. And you can leave the coverage gap once you and your plan have spent $7,050 in out-of-pocket costs, and then you automatically qualify for the catastrophic coverage. This is the standard benefit when looking at a Medicare drug plan. Monthly premium, yearly deductible, co-payments and co-insurances, and of course there's some cost when looking at the initial coverage limit and whether or not you qualify for catastrophic coverage. Now, there is a monthly Medicare Part D standard premium income-related monthly adjustment amount. And every year this gets calculated based on your federal tax return. Now, this income-related premium adjustment, known as IRMA, is determined based on your 2020 tax return. So in 2022, you will pay your plan's premium if your regular income in 2020 was $91,000 or less for an individual, or $182,000 if you're married individual filing jointly. And again, looking at your tax return from 2020, then again, you would pay your plan's premium. But again, as you make more money in looking at your tax return, you could pay a sliding scale based on that, in addition to your monthly Medicare Part D plan. So again, it's not the plan that you pick that picks this. It's the plan that you pick, and then the cost is added on based on your tax return from 2 years prior. What's important to note, though, is if you're filing separately, you lived with your spouse at any time during the taxable year, your income could be from $91,000 to $409,000. You will pay the plan's premium and then the IRMA amount of $71.30 added on to that. Now, again, when you look at this chart, very similar to the Medicare Part B premium IRMA. Again, this is all based on your prescription drug coverage plans, and then you'll look and see whether or not you have to pay an additional amount. You can always appeal this. So again, if your income changes for some reason, maybe you had a windfall the year before, or there's a reduction in your IRMA, you can always file with the Social Security Administration. And again, you can look for that because they have a copy of the Medicare Income Related Monthly Adjustment Amount Life-Changing Form, and that's SSA Form 44. So go ahead and visit the SSA website because, again, you can always file an appeal to see if you do not agree with this IRMA adjustment amount for whether Medicare Part B or Medicare Part D. Okay, now let's learn more about how Medicare Part D works. I talked about this earlier, saying that Medicare Part D is an optional coverage. Again, Medicare contracts with private insurance companies that offer this drug coverage to people with Medicare. Now, everyone with Medicare is eligible to be a part of the Medicare drug coverage. But what's interesting to note, though, is that if you do not have any kind of creditable drug coverage, which is coverage as good as Medicare's, and you do not enroll into the Medicare Part D plan when you're first initially offered, then you may pay a penalty if you decide to join later. Now, you can also get prescription drug coverage through a Medicare Advantage plan that does offer drug coverage. But of course, if you have Medicare drug coverage through a Medicare Advantage plan, you have to have both parts, Medicare A and B. Now, each plan has the flexibility to set up their formulary. Now, a formulary is really just the list of their covered drugs. We know that they have to offer at least, each plan has to offer a range of drugs. So again, they have to have them in each therapeutic class. They have to offer brand name and generic medications. And again, they have to ensure that people with different medical conditions can get treatment and what they need. All Medicare drug plans have been reviewed. So again, somebody has reviewed this process. And again, they have to cover drugs in all of the 6 protected classes to treat certain conditions. This includes cancer, medications, HIV and AIDS treatments, antidepressants, antipsychotic medications, anticonvulsive treatments for epilepsy and other conditions, and immunosuppressants. So we know that they can't exclude anybody based on those certain medications. Now, there is an out-of-pocket cost, could be lower if you pick a Medicare drug plan that has a preferred pharmacy. So again, something to do when looking to cut costs, you want to go through a preferred pharmacy to lower that. And if you have some sort of limited income and resources, we do have a program called Extra Help that will help pay for your prescription drug costs. All right, let's move on to the next slide and get a better understanding on some considerations when looking at a prescription drug plan. I mentioned to you when looking at a Part D plan, you want to make sure that your drugs are going to be covered. So again, look at the different options that you have, whether it's a Medicare Advantage plan with drug coverage or just a standalone prescription drug plan. You want to make sure that each drug is going to be covered. Is there a pharmacy near you? Is it a preferred pharmacy? Really want to understand when you can choose a plan and how to join. So again, we know that you will pay a late penalty if you do not have creditable drug coverage when you're first initially offered under Medicare. And if you did not pick a plan in a timely manner, you could face a lifetime penalty. So again, if you did not have credible drug coverage, so more than a 63-day gap, we know that you could face a penalty added on to your prescription drug plan. There is extra help to pay for prescription drug costs if you have limited income and resources, and we'll go through those resources in just a few minutes. Now, what exactly is extra help? Extra Help is a special program designed to help those with limited income and resources. It's also referred to as the low-income subsidy. And if you qualify based on that, you'll pay no premium or deductible, and you may have a small or no copayment for your prescriptions. Now, what's also interesting is if you have slightly higher income, then you will pay a reduced deductible and just a little bit more in terms of out-of-pocket cost. There's a simple application that allows you to process this looking through Extra Help. And again, there's no coverage gap or late enrollment penalty if you do qualify for Extra Help. So it's pretty clever. And again, it really helps us reach out those individuals who may be looking for some extra help. Maybe they may not qualify for Medicaid or Medicare savings program. So they have a little bit slightly higher income, but that they still need help with prescription drug costs. This is an option for them. Let's look at the next slide as you learn more about how to qualify for this. Now, we know you're automatically qualified if you have full Medicaid coverage. Sometimes you'll hear that known as a full dual. If you qualify for supplemental security income, SSI, or if you get any help in paying for your Medicare Part B or Medicare savings program. If you learned about those yesterday, that's the SMLMB, QMB, those programs, the Medicare savings programs, sometimes those are known as partial duals. They will automatically qualify for the Extra Help program. But all others that may be on that consideration should consider applying, and you can do that a couple of different ways. You can always work with your state Medicaid office or your SHIP, your state health insurance assistance program. But really the best way is also applying online at socialsecurity.gov. They've got an option to go ahead and enroll directly and apply through them to see if you qualify for Extra Help. Or again, you could always contact Social Security at 1-800-772-1213 and ask for the application for Medicare prescription drug costs. Let's get a better understanding of the Medicare Part D late enrollment penalty. Okay, if you choose not to join a Medicare drug plan at your first opportunity, you will pay a late penalty in addition to your regular monthly premium if you decide to enroll later. Now, if you have credible drug coverage or if you qualify for extra help, we know that you will not have a late enrollment penalty. And here's how Medicare calculates that. The late enrollment penalty is calculated by multiplying 1% times the number of full uncovered months you did not have prescription drug coverage once you were eligible or you did not have credible drug coverage at the time. And they use the national base premium. And for 2022, it's $33.37. Now, the final amount is rounded to the nearest 10 cents and added to your plan's monthly premium. The national base premium changes every year, so that penalty amount could change. And you may have to pay this penalty as long as you enrolled in a Medicare drug plan. So I know when the penalty was first announced, people thought, well, I'll just get the least expensive prescription drug plan, and then they can calculate the penalty based on that. No, they look at the national base premium. And so they'll look to see how many months you did not have prescription drug coverage and base it on the national base premium. Now, your Medicare plan is required to tell you if you owe a penalty and what your payment will be. The late enrollment penalty goes to the Medicare Trust Fund. It does not go to the plan. If you do not agree with the late enrollment penalty, you may be able to ask Medicare for a review or reconsideration, but you will need to fill out the reconsideration request form that your plan will send you, and then you'll have the chance to provide the proof that supports your case. So again, look to see if you qualify for reconsideration if it's something that you're not aware of. But again, if you do not have credible drug coverage when you're first initially enrolling into the Medicare program, you could face a lifetime penalty. All right, let's look at the next slide here and get a better understanding. Should we try our luck with the video here?
I troubleshooted it, so if you want me to, I can go ahead and then you can cue me if it's obviously not.
All right, let's see.
If you have to pay a late enrollment penalty for Medicare prescription drug coverage, or Part D, the penalty will be added to your monthly premium. To calculate the penalty, multiply 1% of the national base beneficiary premium for the current year by the number of full uncovered months you didn't have Medicare Part D or creditable prescription drug coverage. For example, coverage from an employer or union that's expected to pay, on average, at least as much as Medicare standard prescription drug coverage. Round that amount to the nearest 10 cents to get the penalty amount to be added to your monthly Part D premium. Here's an example. Let's say you go without creditable drug coverage for 20 months before you join a Medicare Part D plan. You'll pay a late enrollment penalty that's 20% of the current national base beneficiary premium. To calculate the penalty, multiply 20% or 0.20 by the national base beneficiary premium. Round your answer to the nearest 10 cents to get your late enrollment penalty. Add the penalty to your plan's monthly premium to get the total you'll pay each month for Part D. The national base beneficiary premium may change each year, so your penalty amount may also change each year. In most cases, you'll pay the Part D late enrollment penalty for as long as you have Medicare Part D coverage.
All right, thanks so much, Harley. So I hope we already got a better understanding of how the Medicare Part D penalty is enacted. Let's learn more about who can really join a prescription drug plan. Okay. When you join a Medicare prescription drug plan, you just need to be in either Medicare Part A, hospital-based coverage, or Medicare Part B, or medical coverage, to get a prescription drug plan, either A and or B. Now, if you're looking for a prescription drug coverage through a Medicare Advantage plan, then you have to have both Parts A and B. The third bullet here talks about Medicare cost plans that offer drug coverage. Well, you have to have Medicare A and B or only Medicare Part B in order to join those plans. But again, anybody is eligible as eligible to join a Medicare drug plan if you are a part of the Medicare coverage. You have to live in the plan service area. What's important to note here, when you're living in the plan service area, if I live in Texas and the plan service area is Texas, and I decide to move to Oklahoma, I'm no longer in that plan service area and I need to change plans. If I live in Dallas County, but then move to Harris County in Houston, I need to look at my drug coverage because maybe my service area is not state specific, but really county specific. Again, I need to live in the plan service area and review those materials to make sure if I do move, I need to change plans. You can't be incarcerated when joining a prescription drug coverage plan, and you have to be lawfully present in the United States. You cannot live outside of the United States when joining a Part D plan. Our friends to the north and south of us, sometimes I run into some people with Medicare who have a home in Mexico, but they frequent the United States. They cross the border, they get all the prescriptions and whatnot, and then go back to Mexico. Well, again, you have to have a U.S. address in order to get prescription drug coverage. So that's important to know when enrolling into this plan. And you would not contact Social Security and say, hey, I want a Medicare Part D plan. Go ahead and give me one. No, you must join a plan in order to get those that drug coverage. So again, Medicare, the coverage is not automatic, and you must choose a plan and enroll in that plan. Now, if you qualify for extra help to pay for your drug costs, Medicare will enroll you in a Part D plan unless you decline coverage and you join a plan yourself. But again, you can only be a member of one Medicare drug plan at a time. All right, let's move on. Okay, when can I enroll in a Medicare Part D plan? Well, right from the beginning of you joining the Medicare program, during your initial enrollment period. We learned about that yesterday, this 7-month window. That's 3 months prior to the age of 65, the month that you turn 65, and 3 months afterwards. Again, during this time frame, this is when your opportunity to go ahead and pick whatever plan you're eligible that you're interested in, whether it's a Medicare Advantage plan with drug coverage or a Medicare drug plan. Now, during the open enrollment period that happens every fall between October 15th through December 7th, this is your opportunity to go ahead and join a Part D plan, change plans, and we know that coverage begins January 1st. Now, you also get an opportunity to join a prescription drug plan. If you get Part B for the very first time during your general enrollment period, you can join a Part D plan from April 1st to June 30th, and that coverage beginning July 1st. Now, there are some other opportunities to enroll a prescription drug plan, and that is through Medicare Advantage open enrollment period and special enrollment periods.
Sylvia just went into some details about extra help, but just as a reminder, we sometimes refer to it as LIS or a low income subsidy. Sometimes it's automatic, but others need to apply, and there's multiple ways to apply for extra help. You can do it online with Social Security, you can call them, you can work with your local SHIP, or even possibly through your state Medicaid office.
All right, thanks so much, Carrie. Now, we learned a little bit about Medicare Advantage plans just a little bit briefly when I talked about prescription drug coverage and when Kim went over the Medigap policies. But let's do a deep dive under Medicare Advantage plans. Okay, Medicare Advantage plans are just another way of you getting your Medicare coverage. Yesterday, we learned about original Medicare fee-for-service, where we work with doctors and hospitals that accept Medicare. Well, this is very similar, but you now have one private company really bundling all of your services under the Medicare program and offering that coverage. Now, Medicare Advantage plan is just another option. Sometimes you can hear it as Part C or MA plans. But again, Medicare approved private companies that follow all of the rules that Medicare sets. Again, somebody has vetted through, they've looked at the provider network, they've looked at the formulary list, they make sure that all of the same services that Medicare offers, the Medicare Advantage plan is offering as well. Now, they may offer some out-of-pocket costs that are a little different than original Medicare because they have a different cost structure. Remember, we learned in Medicare, original Medicare, outpatient services, Medicare pays 80%, you pay 20%. Well, they have a different cost structure that's associated with how they set up their plan. In most cases, though, you will have to use the doctors that are on that plan's network. And if you decide to go outside of that network, typically you're going to pay a higher cost. What's important to know about Medicare Advantage plans is that they may offer extra benefits that Medicare under the original Medicare program does not cover, like vision, hearing, and dental services. There's also some marketing out where some plans are offering like meal delivery or transportation. I will just let you know that you want to look at every plan to see what they're offering and what the extra benefits are going to be included. And again, they may not be available in all areas. So when you're looking at different Medicare Advantage plans, you want to get a better understanding exactly what they're offering. All right, let's see what else we want to learn in terms of how they work specifically. Okay, when you join a Medicare Advantage plan, again, you still get the same rights and protections as somebody who has original Medicare. So again, you're still protected. You get all of the same Medicare Part A and Part B services. But again, the Medicare Advantage plan will choose how they're going to offer those services as well. Now, you can pick a plan that offers prescription drug coverage. And again, the out-of-pocket costs are just going to be a little bit different. They may set the co-payments for or co-insurance for every doctor visit as $20, but yet the specialist is $50. You have to look at the plan details to see when you're enrolling in one of these Medicare Advantage plans, what the costs are going to be. They can't charge you for more than what original Medicare pays for in terms of chemotherapy, dialysis, and skilled nursing care. And again, I did say that they do offer extra benefits at things that Medicare does not cover. Vision, dental, fitness, and wellness benefits. And again, they may have a yearly limit on your out-of-pocket costs. Now, I want to give this quick note here. Medicare Advantage plans can also cover more extra benefits than they have in the past. And we've seen a lot more marketing with this, doctor's visits, over-the-counter drugs, adult daycare services. You really want to get a better understanding when you look at the plan benefits through the materials from that plan to see if it's something that's going to be included in that particular plan. Okay. Now, each plan has a service area. I talked about that a little earlier when you're picking a plan. Make sure that you are in that plan's service area. Now, when you want to understand how original Medicare is paid out, we learned how that worked yesterday. You can get an understanding of how the plan will pay for certain services. And if you want to see if an item is going to be covered by a plan in advance, you can ask for an organization determination. That's you and your provider championing on your behalf to really request to see, is this going to be covered by the plan? And again, the plan has all of that information available to you and how you can contact them directly. Now, each plan, again, can set different out-of-pocket costs and have different rules of how they want to do that. And every year, those rules can change. So you really want to pay attention every year when you get something in the mail known as an annual notice of change from the plan, saying if anything in particular, how maybe their phone numbers change, maybe they no longer take things via fax, it's only by email. It just depends on how that plan set that up. Now, Medicare Advantage plans, again, I said, cannot charge you more than original Medicare for some things like chemotherapy, dialysis, skilled nursing care. And again, if you have an out-of-pocket costs for medical services, they do put a yearly limit every year, Medicare Advantage plans do. Yesterday, we learned about the hospice coverage benefit. Again, if somebody in a Medicare Advantage plan elects to be a part of the hospice program, well, they'll revert back to original Medicare because, again, that's a benefit under the original Medicare program. All right. Let's move on to Medicare Advantage plan costs. Now, when you're joining a Medicare Advantage plan, you want to consider some things. You know that there will probably be a monthly premium. What you want to consider here is you're looking to see, I've got my Medicare Part B premium that needs to be met because you have to have both Parts A and B to join a Medicare Advantage plan. And then you have to pay an additional monthly premium for that Medicare Advantage plans. Now, some plans will market that they will pay for part or all of your Medicare Part B premium. So if that's the case, this is known as a Medicare Part B premium reduction. And again, some of them will advertise for that. You may even see some marketing will say a zero premium plan, Well, it may be a zero premium plan, but you still need to maintain the Medicare Part B premium. You also want to make note of any yearly deductibles or any additional deductibles for certain services. The standard thing is if it's a higher premium, then you probably have a lower deductible. So when evaluating which Medicare Advantage plan you want to consider, look again at the monthly premium and look at the yearly deductible and anything else. You also want to make sure what the co-payments or co-insurance amounts for each visit or service. For example, a plan may charge a co-payment for $10 or $20 every time you see the doctor. So again, you just have a better understanding when looking at the plan details of what your out-of-pocket costs will be if joining a Medicare Advantage plan is what you're thinking of. All right, let's move on. Other things you want to consider is, well, other additional out-of-pocket costs you might need, like are all my providers on that plan's network? I must consider if I choose a doctor that's out of the plan's network, well, then I may be paying more. Look to see what type of healthcare services you need. How often are you going? Things to consider when calculating whether or not this is going to be advantageous to your budget. You want to make sure whether or not you're going to get extra benefits that require an extra premium. Look to see if that's something you're looking at. And the plan's yearly limit on the out-of-pocket cost for all medical services, because typically once you reach this limit, you'll pay nothing for covered services for the rest of the year. And if you have Medicaid, which is the state assistance program, you can get some help from your state to help pay for healthcare costs as well. Every year, the plan will set out the amounts they charge for premiums, deductibles, and services. The plan, rather than Medicare, decides how much they'll pay for these services and what the plan may change. They can charge this once a year, and they can make a change by January 1st. This annual notice of change or the evidence of coverage gives you this notice every fall to kind of describe, hey, as we're moving into the new year, out-of-pocket costs for doctor's visits could move up $10 or $15, just depending on that particular plan. So again, pay attention to the annual notice of change. Okay, let's look to see who can enroll. Well, like I said, you have to have both parts Medicare A and B, hospital-based coverage and medical coverage, Medicare A and B. You have to live in the plan service area. You must be a U.S. citizen or lawfully present in the United States, and you cannot be incarcerated at the time of enrollment. To join the plan, and you can only be in one plan at a time, you need to provide the necessary information to the plan. And what this means is if they're asking for your address, they're verifying your Medicare information, like your Medicare number, date of birth, and other information. If you don't provide all that information, then they can't process your application. You have to follow the plan rules. I can give an example of following the plan rules here. I've seen some concerns where people have said, well, I kept going to my doctor and it keeps getting denied, but the plan has said multiple notices saying that this doctor is not in the plan's network. And if you continue to go to that doctor, this is the out-of-pocket cost, or we don't cover that particular coverage. If you are not following the plan's rules, again, the plan cannot offer that coverage if they're sending you notification at that time. And again, belong to one plan at a time. We saw this initially when sometimes we saw it with prescription drug coverage. We also saw it with Medicare Advantage plans with drug coverage, where the incentive to join one plan sounds great, and the marketing piece that I got with it, like a gift card, but then I joined another plan because I liked that they were giving away, let's say toasters at that one. You can only be in one plan at a time, and typically the last plan that processes the application is the one that sticks. So again, really, when we're working with people with Medicare, we want to make sure that they understand they can only be in one plan at a time. They do not work together. Okay. Now, when can you join a Medicare Advantage plan? Well, right from the beginning. If I'm new to the Medicare program, I can go ahead and elect to be a part of a Medicare Advantage plan that's with or without drug coverage. Again, this 7-month window allows me to go ahead and pick a Medicare Advantage plan. If you change to another Medicare Advantage plan with or without drug coverage, or go back to original Medicare with or without drug coverage, you can do that within the first 3 months of joining joining Medicare. Now, every year we have the yearly Medicare Advantage open enrollment period. And this is pretty exciting because it gives you this one-time change during January 1st to March 31st each year, with coverage beginning the first of the following month. But here's what you need to have. You need to have already been enrolled in a Medicare Advantage product on January 1st in order to use this open enrollment period. Now, during this time frame, you can switch to another Medicare Advantage plan that has drug coverage or not. Or you can say, listen, I don't want to be a part of this. I want to go back to original Medicare. If that's the case, you can go back to original Medicare and pick up a Medicare Part D drug plan if you want to go ahead and do that. But again, you have to already have been in a Medicare Advantage plan on January 1 in order to switch to a Medicare Advantage open enrollment period to another plan or whatnot. Now, if you're new to Medicare and you're currently enrolled in a Medicare Advantage plan during your initial coverage coordinated enrollment period or your Medicare Advantage open enrollment period, and the month of entitlement is A and B is through the last day of the third month of entitlement, well, again, this is an opportunity for you to join a Medicare Advantage plan as well. Now, the enrollment period does not allow for Part D changes for individuals enrolled in original Medicare, including those who are enrolled in a standalone prescription drug plan. So again, if you have Part A and didn't enroll during your initial enrollment period, you can now enroll during the general enrollment period, right? And that coverage begins July 1st. Something to pay attention to as well. So you really want to pay attention to the Medicare Advantage open enrollment period if you're trying to get out of a Medicare Advantage plan, or if you want to switch to a Medicare Advantage plan. This is an opportunity between January 1st to March 31st. Okay, let's move on to the next slide. Some other open enrollment periods to pay attention to. Well, every fall we have the open enrollment period, October 15th through December 7th. We see a lot of people making changes during this time frame. They're going to review their annual notice of change. They're going to review their evidence of coverage, and they're going to say, hey, maybe I want to change plans. This is your opportunity to do that. It becomes effective January 1. Now, if you have Medicare Part A and you enroll in Medicare Part B during the general enrollment period, you can pick a Medicare Advantage plan and it'll become effective July 1, but you would do that between April 1st through June 30th. So again, you have the opportunity to be a part of a Medicare Advantage plan. Now, we also have special enrollment periods. And these are qualifying events that could happen throughout the year. Say the plan moved out of your area, that's a special enrollment period that allows you to pick a plan, a new plan. If you're moving service areas, if I'm moving from Texas to Oklahoma, again, that's a special enrollment period, things that could happen throughout the year. Check with the plan, or you can also visit Medicare.gov to see about some special enrollment opportunities when looking at Medicare Advantage plans and changing throughout the year. Okay, let's move on. Now, how do I join a Medicare Advantage plan? Well, the first bullet here really highlights Medicare.gov. Medicare.gov has a plan compare tool that allows you to type in your prescriptions, type in your pharmacy that you're going to, look to see what's a preferred pharmacy, look at Medicare Advantage products that are available in your area, and you can get a deep dive and learn about what the different plans are in your area. You can see what extra benefits they're offering, and you can look at the plan details specifically, like a link to their website that allows you to look at the different providers, look at the network, what the hospital is nearby. This plan compare tool allows you to go ahead, look at the different products, and then you can enroll directly through the plan's website, through the Medicare.gov website. You can also visit the plan's website specifically and join online through that. There are some paper applications that each plan may have, so you can call the plan specifically to join with them directly. And of course, 1-800-MEDICARE can also offer assistance in looking at it. So when you call Medicare Advantage plans, you will have to provide information like your Medicare number, the date of your Part A and Part B coverage dates. And you'll have to enroll in a Medicare Advantage plan. You'll have to use their card, the Medicare Advantage plan, in order to get those services. Okay. The next slide is pretty clever here. It allows you to do a side-by-side comparison. You can look to see what is the difference between Medigap, the Medicare supplemental insurance policies that we learned about earlier today, and Medicare Advantage, the managed care option. Both are offered by private companies. But Medigap policies are going to be governed by the state. So again, we know that the oversight is going to be by the state. Medicare Advantage plans, the federal government oversees Medicare Advantage plans. And again, they have to be approved by Medicare. So Medigap, the state looks into. Medicare Advantage plans, the federal works with. Well, Medicare Advantage plans are really your Medicare coverage. You're going to have all of your Medicare A and B coverage together as bundled. And if you choose drug coverage through them, it's going through that particular company. Under Medigap policies, you have to have original Medicare because, again, it's offering that supplemental insurance and helps fill in the cracks of what Medicare is not going to cover. So again, the coverage is just filling in deductible payments, co-insurance, co-payments. That's what Medigap policies cover. Medicare Advantage plans, again, that's your coverage through that particular company. Now, you have to have both parts A and B to be a part of these policies, both Medigap and Medicare Advantage. And again, they will have a monthly premium. So again, the Medigap policies, Kim talked earlier today about that. It depends on what policy you get, how it's rated, and what your monthly premium will be for that particular policy. Medicare Advantage plans, you'll learn more right from the get-go, what the policy is going to be, what it's going to cost you, if it's a premium-free plan. Again, you still have to maintain the Medicare Part B premium. All right, let's get a better understanding of how original Medicare works versus Medicare Advantage in terms of doctors and hospitals. If you have original Medicare fee for service, you know you can go to any doctor or hospital that takes Medicare, and that could be anywhere in the United States. And in most cases, you won't need a referral to see a specialist because, again, you're working with any doctor or hospital that takes Medicare assignment. Now, Medicare Advantage plans, this managed care option, you really need to use the doctors and other providers who are in the plan's network. Now, some plans will offer non-emergency coverage and out-of-network, but typically that's going to be at a higher costs. And some plans have been designed that you will need a referral in order to see a specialist. So again, that's original Medicare versus Medicare Advantage and looking at doctors and hospital choices. The next slide will go into and learn more about the differences in terms of costs. Let's look at the left here on original Medicare. All right, we learned yesterday that Medicare Part B covered services, Medicare pays 80% and you pay 20% for that covered service. You may need to meet a deductible, and again, your co-insurance of the 20%. You still have to have a Part B monthly premium. Again, Medicare Part B premium is based on IRMA as well, so you either are paying the standard premium amount for Medicare Part B or you may be paying more, depending on your IRMA status. There's no yearly limit on what you pay in terms of out-of-pocket costs when looking at original Medicare, unless you have supplemental coverage like a Medicare supplemental insurance policy. Now, you can purchase a Medigap policy that will help fill in the gaps if you have original Medicare, or you can use coverage from a former employer or union. Sometimes there's some retiree coverage that you could use that serves as secondary, that helps fill in what, after they bill Medicare first, the second one will come in and pay. Or Medicaid. Again, Medicaid is typically the payer of last resort. So we know that Medicare will get paid first and then Medicaid comes in. Now let's look at Medicare Advantage plans and the costs associated with that. Well, their out-of-pocket costs will vary. Again, you may have different out-of-pocket costs for certain services like doctor's visits versus specialists versus hospital stays. You still have to pay the Part B premium, and you may have to pay an additional premium with that particular plan. There is a yearly limit on what you pay in out-of-pocket covered services for Medicare A and B under a Medicare Advantage policy. And once you reach that plan's limit, you'll pay nothing for services for Medicare A and B for the rest of the year. Now, Medigap policies and Medicare Advantage plans do not work together. You can have either or. Again, the two do not work together. So you can't buy and you will not need a Medigap policy if you're in a Medicare Advantage plan. Okay, again, let's look at the coverage now. Under original Medicare, again, Medicare will cover most typically medically necessary services and supplies in your hospital, your doctor's office, or any other facility. Medicare does not cover things like eye exams, dental coverage, and routine exams. If you're looking for prescription drug coverage, you need to join a separate prescription drug plan in order to get that particular coverage under original Medicare. And in most cases, you will not get a service or a supply approved ahead of time for original Medicare to cover it. You don't have to get that. Okay, now let's look at Medicare Advantage plans. All right, under Medicare Part C, again, plans will cover all medically necessary services, but they may offer extra benefits. So again, routine exams, vision, hearing, and dental. If you choose drug coverage through a Medicare Advantage plan that's offering drug coverage, then again, their prescription drug coverage will be covered through that. And in most cases, when you're looking at coverage, you have to get a service or supply approved ahead of time for the plan to cover it. And again, we talked about that in terms of looking at an organization determination. Again, the people with Medicare and their doctor will champion together to find out if a covered service is going to be covered by that particular plan. All right, let's look at foreign travel here. All right, typically Medicare does not pay for coverage outside of the United States. Now, I've seen a couple of cases in my experience as a caseworker where the closest hospital was across the border, and then once you were stable enough, they were able to transport you back to the United States. But again, original Medicare does not typically cover any coverage outside the U.S. If you have a supplemental policies, they may offer coverage outside the United States, and it could be in emergency situations. But again, look at the policy specifically. Medicare Advantage plans don't cover outside typically of the United States, but they may offer a supplemental benefit that covers emergency or urgency needed travel insurance outside of the U.S. So again, look at the plan, look to see if that's something that they can offer. But again, typically it's not going to be covered outside the United States.
We're going to switch gears a little bit and talk about coordination of benefits. So I'm going to turn things over to David Santana, who's going to lead us through this presentation.
Thank you, Carrie, and hello, everyone. So from this point forward, as Sylvia mentioned, we will cover coordination of benefits. We're also going to be talking about fraud, Medicare fraud, waste, and abuse, and also CMS program-related resources. So I think that between yesterday and today, we'll learn a lot about how people get enrolled in Medicare, who qualify for Medicare. And you also heard about choices that people have when they have Medicare. One of those choices are staying in the original Medicare. Specifically, they have other type of health insurance, whether it's an employer health insurance based on current employment, retirement. They may also have other coverage for military retirees and family members, TRICARE. They may have COBRA coverage, Medicaid. So there are many types of coverage that people with Medicare have. So it is important to understand the very basics of how coordination of benefits works so that we can properly educate individuals, because nothing is more frustrating that when you receive medical services and those medical services are sent for payment, that even though you may have one or two policies or even three policies, everyone start denying those claims, and it could be very lengthy and difficult process to bring everyone in order. So I think it will be very helpful for all of us to understand those basic rules. So when individuals have more than one health insurance, each type of health insurance is usually called a payer, and that includes Medicare. And of course, when there is more than one payer, coordination of benefits rules determine which one pays first. And you probably, if anyone have ever had any type of experience dealing with more than one payers, sometimes no one wants to be the primary payers, and everyone is pointing to the other as the primary payer. So who sets those rules? So we know that we have a market that is outside of Medicare before an individual become eligible for Medicare, and then after the individual become eligible for Medicare, which one sets the coordination of benefits rule? Now, for the private markets, it's usually most of the plans follow the National Association for Insurance Commissioners standards determining which payer will be primary. For example, you know, if when there is a couple, a married couple who has health insurance on their own through their own employer, and they each other are covered by each other's employer plan. There's also the dependence of those individuals who may have each parent's health insurance. So usually they will look at the National Association of Insurance Commissioners to determine which policy would pay first. I think when the individual enrolls in Medicare is when the question comes in, okay, how does Medicare fits into this puzzle of coordination of benefits? And if was already a rule set up by the NAIC, or National Association of Insurance Commissioners, how does that fit into Medicare? I think the first, I guess, facts to take away from this is that Medicare secondary provision is a federal law, and it will supersede any other coordination of benefits agreement that other payers have outside of Medicare. And we'll learn a little bit more in the coming slides in terms of how those Medicare payer rules falls within the other payers. So Medicare may be primary, or the individual may be primary, may have a primary payer, a secondary payer, and they may also have a third payer. So let's take a look at the next slide how Medicare usually pay claims. The slides is showing, okay, it's coming back, okay. So usually Medicare pays primary, you can, or you can assume rather, that Medicare is primary when you don't have any other source of health insurance, right? Medicare may also be secondary payer. So when does Medicare become a secondary payer? So when a primary plan payment for Medicare coverage service is less than the provider's charge for the service, and less than Medicare gross amount, and the provider does not accept and is not obligated to accept the primary plan payment as payment in full, then and only then Medicare may consider to pay as a secondary. Medicare may not make payment at all on the claim, and as I just finished mentioning, if there is a primary and their primary payment was accepted by the provider as payment in full, or the provider was obligated to accept it even if the provider billed more, then Medicare doesn't pay for those claims. There's also non-group health plans such as liability, workman's compensations, and such that they are required to pay usually for service, and Medicare typically doesn't pay for services that are covered by non-group health plans such as liability plans. So let's move on to the next slide. So there are some instances that, as I mentioned in the beginning, it's important to know some instances that Medicare is almost always primary payer, so we can properly guide the individual who are tangled up in determining who should be primary or secondary. So you can assume that Medicare would be your primary payer. For example, if you have a Medigap policy, and we will learn about Medigap policies that can walk us through that process earlier today, that coverage rather. So when you have a Medigap policy, those policies are specifically designed to follow Medicare. I think one one important thing to know when we look at Medigap and coordination of benefits is the fact that Medigap follows Medicare. So if Medicare denied a claim, Medigap denied the claim for whatever reason. So they are strictly to follow Medicare payment rules. Another interesting point about Medigap policy is that if you are enrolled in Medigap policy, those Medigap policy have a coordination of benefits agreement with each Medicare administrative contractor. That means that when you receive a service and the claim is billed to Medicare, usually that claim is forwarded automatically to your Medigap policy. So typically the individual doesn't get involved or the provider doesn't have to go out of their way to trying to file a claim to Medicare, because each and every Medigap policy is required to have a coordination of benefits agreement with the Medicare administrative contractor, whereby they will receive claims automatically after Medicare payment. One of the things or one of the issues rather that people run into when they have a Medigap policy, for example, if a Medigap policy, let's say the Medigap policy that you have don't pay for hospital deductible. So if you go to the hospital and you are charged a deductible and the Medigap policy doesn't pay for that deductible, usually that claims there is no need for that claim to go to the Medigap because they simply do not pay for the deductible. So the individual is tangled in a process. So why didn't the claim went to the Medigap for payment? Where simply usually because that service is not covered by the type of Medigap policy that you have. When we look at Medicaid, Medicaid is a payer of last resort. So regardless of the number of payers that you may have, Medicaid will be looked at as a payer of last resort. Typically, if you have 1-2 policies, there may be nothing left for Medicaid to pay for it. Nevertheless, they will always be the payer of last resort. If you have coverage, for example, through a group health plan, but you are retired. So if you are retired, usually Medicare will be your primary health insurance. If you have Indian Health Services, if you have TRICARE for Life, which is for military retirees and family members, you are required to enroll in Medicare, and Medicare is primary to TRICARE for Life. You could always assume that Medicare is also primary to COBRA. COBRA is a continuation of employer coverage. If for any reason you lose your employment or your hours were reduced, that you no longer qualify to that employer health insurance, COBRA offers a continuation of coverage that is usually up to 18 months. And of course, it's up to you to choose your continuation of coverage under COBRA, but you could always assume, almost always, that Medicare would be primary to COBRA benefits, except if the individual is under the 30-month coordination period for people who have end-stage renal disease. So for end-stage renal disease, an individual who become eligible for Medicare because of end-stage renal disease, regardless of what type of group health plan you have, that group health plan is typically primary for 30-month coordination period. And that would include, for example, COBRA. If you are in the 30-month coordination period, you become eligible for COBRA. COBRA will, your coverage under COBRA will continue to be primary until the conclusion or the 30-month coordination period, or in some instances, COBRA may end before the 30-month. As I mentioned, that usually the extension is for 18 months. So if you reach the end of the coverage for COBRA, of course, then from that point forward, Medicare will be your primary health insurance. Now, so what is Medicare secondary payer? So oftentimes, as I mentioned, individuals have other source of health insurance, specifically through an employer plan. And sometimes those employer plans are working great and people are very happy with those plans. They happen to retire and they may be required to enroll in Medicare, or they were already retired and they become eligible for Medicare. They may be required to go ahead and enroll in Medicare. So many individuals have become accustomed to use their plan providers, and the providers participate in the plan. So when it comes to Medicare, some individual may want to just keep their plan paying as it is. So they start questioning what exactly is Medicare secondary payer, and why would Medicare will take the place of a primary payer at these points. So the easiest way, or I guess the simplest way that you can go about explaining Medicare secondary payer, it is that it is a law. It is actually a federal law that was designed to make Medicare secondary payer to the maximum extent possible. So Medicare will always be looking at each and every possible payer that you may have and see if Medicare could be actually, if that payer should be primary to Medicare. So those provisions can be found under Section 1682B of the Social Security Act, and that is basically for reference. Section 1862B is basically the controlling law, and those laws are codified under Regulation 42, Electronic Code of Federal Regulation, Part 411. And also you can look for more detailed information about Medicare secondary payer under Medicare publication number 100-05, which is titled Medicare Secondary Payer Manual. So if you were to contact us as CMS looking for specific information about a specific case and coordination of benefits, we will look through those three resources that I just mentioned: the Social Security Act, the Code of Federal Regulation, and then for more detailed information, we also look at the Medicare Secondary Payer Manual. Together, these laws have helped save about $8.8 billion annually to the Medicare Trust Fund. Now let's take a closer look at how Medicare coordinate benefits with group health plan, which is typically the coverage that the individual would have when they enroll in Medicare, and how the coordination of benefits take place. So when does Medicare is required to pay first? So let's take a look at an individual who is 65 years of age and older and retired. So as I mentioned, when you're 65 years of age and older and you have coverage through a group health plan, you could always assume that Medicare will be your primary payer. So the first question is, yes, I have an employer plan. The second question is, are you working or retired? If you're retired, Medicare is likely your primary policy. If the individual is 65 or older with a group health plan through a current employment, then the law asks us to look at the amount of employers that employer has. If it's a small employer with 20 or less, either full-time or part-time employees, then Medicare is required to pay as primary. If the individual is eligible for Medicare, is under 65 and eligible for Medicare based on disability, then we'll look to see if the employer plan has fewer than 100 full-time or part-time employees. If they have fewer than 100, then Medicare is required to be the primary payer for that plan. So I also mentioned about ESRD. So if the individual is eligible for Medicare due to ESRD, the plan, regardless of the size and regardless of the fact that the individual is working or retired, that plan is usually required to be primary to Medicare for 30-month coordination period, after which Medicare will be your primary policy. Of course, if you already enrolled in Medicare and Medicare was your primary, when you develop end-stage renal disease, there is no coordination period. Medicare will still your primary policy moving forward. Right, thanks, Carrie. So another, I think, important aspect after the Affordable Care Act was the creation of the health insurance marketplaces and the fact that we do have now, I believe the population is about over 14 million people that are enrolled in a health insurance marketplaces. So it is really important for all of us to have a basic understanding of how Medicare works with the marketplace. So the first thing to keep in mind is that if you already enrolled in Medicare, it is against the law for someone that knows that you have Medicare to sell you a marketplace plan. So that's the first rule of thumb here. If you have Medicare, it is against the law to sell you a marketplace plan. And it doesn't matter whether you have Medicare Part A or Medicare Part B. There's one exception to this rule, and that is, as you probably are aware, individuals who have small employers and those working for small employers, and those small employers purchase health insurance through the marketplace, those employers are treated as any other employer. That means that if you have if you're working for one of those small employers and you have health insurance through them, even if the health insurance purchased through the marketplace, the size of the employer would determine on whether that plan is primary or secondary to Medicare. And we just finished explaining how that typically works. And the other fact is that if you have an employer plan, group health plan, and that's based on current employment, you qualify for Medicare special enrollment period, right? When you lose that employer plan or you retire, you typically have 8-month special enrollment period to sign up for Medicare without having to pay a penalty. On the next slide, we'll talk about having a marketplace and becoming eligible for Medicare. And I think this is the typical scenario, right? That the individual may purchase a marketplace plan before they become eligible for Medicare. So how does that work? So if an individual is enrolled in a marketplace plan and become eligible for Medicare, what choices do they have? Well, one of the choices is that they can keep a marketplace plan after their Medicare coverage begins. But there are several things that they need to keep in mind if they choose to do that. Once your Medicare Part A coverage starts, you will no longer be eligible for premium tax credit and co-sharing reduction. As we all know, those plans are allowed to price their policy based on age. A policy for an individual who is 65 or over could be 3 times the amount of an individual who is, for example, maybe 21 years old. So those policies could become really expensive if you lose the premium tax credit and co-sharing reduction. So although you will be able to keep the plan, you will have to pay that policy in full. Now, marketplace plan doesn't really work with Medicare. So keeping a marketplace plan, thinking that you would have a coordination of benefits agreement there, similar to the one that I just explained for the typical employer group health plan, is a mistake. Those plans do not coordinate benefits with Medicare. So if you go ahead and enroll in Medicare, yes, your Medicare will become your primary policy, but those plans as secondary may not be able to pay much. Those plans doesn't have a coordination of benefits agreement with Medicare, which means that Medicare will not be transferring claims to them. It would be up to the individual or the provider to file those claims with the plan. Now, we have instituted several safety I guess, steps in there to help individual with this process. First of all, if an individual is aging into Medicare, have a marketplace plan, and they're aging into Medicare, they will receive a notice from Medicare. It's called a special Medicare notice for people turning 65. That's the first notice that the individual will get, letting them know you are aging into Medicare, and we are encouraging you, or strongly encouraging you, to go ahead and enroll in Medicare and terminate the marketplace plan because of the reason that I just explained, that you will lose premium tax credit and co-sharing reduction. There's no coordination of benefits. If you delayed enrollment in Medicare and you have one of these policies, you typically will be penalized if later on you wanted to sign up for Medicare. So that notice encouraged the individual to sign up for Medicare during their initial enrollment period. And we all learn about the enrollment periods into Medicare. So that notice explained that. Now, there's a second way that we go about protecting those individuals as well. As part of the marketplace application, individual can attest to the marketplace when they signed up that if in the future they become eligible for Medicare, for other coverage such as Medicare, Medicaid, CHIP, that they can attest to the marketplace that if they do become eligible, to go ahead and terminate the marketplace plan. So it's authorizing the marketplace plan, the marketplace to terminate their plan when they become eligible for Medicare or Medicaid. So that way they will not end up, for example, receiving premium tax credit beyond that and then having to pay back when they file their taxes. Because again, after you become eligible for Medicare, even if you don't sign up for premium-free Medicare, even if you don't sign up, your premium tax credit and co-sharing reduction should be terminated. And if it's not terminated, then you will end up owing taxes. Now, the marketplace over the year has been able to adopt and implement tools to help those individuals. So periodically, the marketplace run data matching through the marketplace, and if they find out that you are enrolled in the marketplace and that you have a marketplace plan and you enrolled in Medicare, the marketplace plan will go ahead and terminate your premium tax credit and co-sharing reduction. And they will send you a notification saying, we're terminating your premium co-sharing, your credit and co-sharing reduction. And we're encouraging you to go ahead and terminate your plan. And if they authorize the marketplace to terminate their plan, then the marketplace will let them know, we're going to go ahead and terminate the plan. You have 30 days to let us know if you disagree with what we will be doing. So again, we have implemented a few tools in there to help individuals mitigate the consequences of, enrolling in Medicare and keeping their marketplace plan. Let's take a closer look at the next slide, which talks about individuals who are eligible for Medicare because of disability. Now, you learned probably yesterday that there is a 24-month waiting period after the individual start to receive cash benefit from Social Security. So during that 24-month waiting period, if the individual join a marketplace plan, they will be able to stay enrolled in a marketplace plan and take advantage of premium tax credit and co-sharing reduction while they wait for Medicare to become effective 24 months later. Now, let's take a look and see the choices that individuals have in the next slide. So choosing a marketplace coverage instead of Medicare. So there are instances that an individual can choose a marketplace coverage instead of Medicare and still enjoy receiving the premium tax credit and co-sharing reduction. So there are three instances that the individual could do that. The first is that the individual do not qualify for premium-free Part A. If they're enrolled in Medicare, paying Medicare Part A premium, they can go ahead and terminate Medicare at any time, Medicare Part A and B, and choose a marketplace plan instead. Or if they haven't enrolled in Medicare, but they qualify for Medicare because based on paying the premium, or because they qualify for Medicare based on end-stage renal disease, but they choose not to enroll, then that individual could keep the marketplace plan as well as premium tax credit and co-sharing reduction moving forward. We always like to advise the individuals that there are options in the original Medicare to help them with out-of-pocket expenses, such as the Medicare Savings Program for people who have limited income and resources. So if getting marketplace premium tax credit and co-sharing reduction is an incentive for those individuals to choose a marketplace plan instead of Medicare, I will strongly recommend those individuals to take a look at enrolling in Medicare and see if they qualify for Medicare Savings Program. For example, the Qualified Medicare Beneficiary, or QMB, paid Medicare Part A premium, paid Medicare Part B premium. That individual would qualify for premium-free Part D plan, and they also qualify for the state to pay their out-of-pocket expenses, the Medicare out-of-pocket expenses. So really, they will have almost a comprehensive package of benefits at no cost to them, as opposed to going to the marketplace and get some help through premium tax credit and co-sharing reduction that may cost them much more than choosing original Medicare and having a qualified Medicare beneficiary that will basically pay for everything. And as you all know, if you have a QMB plan as well as Medicare, the providers are prohibited from balance billing you. So mainly that means that you would not pay anything out of pocket. So I would not rule out completely just because you're getting premium tax credit and co-sharing reduction, and you could have that choice. You may be better off with Medicare if you qualify for QMB. Now, the next slide just walks us through a scenario to see, to test our knowledge about what we just learned about Medicare and the marketplace. So we have Leslie here, who has individual marketplace coverage. She's turning 65 and want to wait and enroll in Medicare Part B when she's older, because she and her husband have the same marketplace plan. Fair enough. Since she's worked long enough that she doesn't have to pay for Medicare Part A, she doesn't have to worry about having a Part B late enrollment penalty. Having a marketplace plan will allow her to enroll later without a late enrollment penalty. Is that true, or is that false based on what we just learned? So the answer to that, it should come up in a minute. So the answer to that question is false, right? That is because having an individual policy in the marketplace do not qualify you for the Medicare special enrollment period. You only qualify if you have an employer group health plan based on current employment status. And I mentioned the fact that if you have, you're working for a small employer who is purchasing policy through the marketplace, in that case, yes, you qualify for a special enrollment period. But here, she just basically purchased an individual policy for her and her husband, and it's not through an employer. So she will be penalized if she waits to enroll in Medicare. Likely, she will get that special notice for individuals turning 65 from the marketplace, and she may, through that notice, she will learn that if she delayed enrollment, she will likely be penalized later on. All right, so let's move on and talk about protecting the financial integrity of the Medicare program, something that isn't our top priority at HHS and CMS to protect the financial integrity of the Medicare program. So CMS program integrity's activities basically target all cause of improper payments, anywhere from honest mistakes to intentional deception. An improper payment is usually any payment that shouldn't have been made or was made, and it wasn't, and the payment that was made was basically incorrect. Now, contrary to what we typically, or the common perception is that all improper payments are based on fraud. That is basically not the case, right? In fact, the vast majority of improper payment are due to unintentional mistakes. I used to work in the Medicare administrative contractors, and the contractors nowadays just deal with this every day, where payments are made, but for example, the coding that was sent for payment was higher than the coding that the actual service that the individual received. That's what we call up coding, that they're billing for higher services that individual receive. It's one of those examples that it may be an honest mistake from the provider to just basically send the wrong code for payment. It's not necessarily fraudulent, but it's a waste in the program to be paying for services at a higher cost. Many overpayments may have been proper, but may be labeled improper due to, for example, lack of documentation, right? If the provider is submitting the incorrect documentations and such. So what do? We use different ways that we can go about mitigating fraud, waste, and abuse. One of them is CMS user provider education and outreach to help avoid billing errors by the provider. And I can tell you that there are many of the bills that are sent for Medicare that it just basically sent in error or by mistake, and they result in improper payment. Now, CMS also uses its payment authority to suspend cases of suspected fraud, waste, and abuse. So we do have our suspension authority to go about preventing improper payment as well. If we see an aberrant, a string of services that are being billed by certain providers, we can take preventive measures to suspend payment for that specific providers until we investigate further. The next slide basically follows or shows us a video that some of the results of the Medicare fraud, waste, and abuse working with law enforcement to prevent fraud.
243 people across the country charged for milking the system for $712 million in false medical claims and bills, including 5 people here in the Bay Area.
A Miami doctor is facing 2 federal fraud conspiracy charges for his alleged role in a $20 million Medicare fraud scheme run by a healthcare company. Federal prosecutors say Dr. Henry Laura wrote home health care prescriptions for Medicare beneficiaries that were unnecessary or never even provided in exchange for kickbacks.
16 people at a North Texas hospice are charged with ripping off federal taxpayers for $60 million.
We discussed today the filing of charges against 3 individuals in connection with their scheme to fraudulently bill Medicare and Medicaid for more than $1 billion in medical claims.
And so today, the Department of Justice, in conjunction with the Department of Health and Human Services, is announcing the largest healthcare fraud takedown operation in American history. 412 defendants, including 56 doctors. These defendants have defrauded taxpayers of approximately $1.3 billion.
So as you can see, that the cost of the fraud, waste, and abuse is tremendous to the Medicare Trust Fund. So it is very important for each and every one of us to make sure that we do our part to help prevent fraud, waste, and abuse. One of the things that we do is work. For example, the Senior Medicare Patrol. It was created to empower and assist people with Medicare, their families and caregiver, to prevent, detect, and report cases of fraud, waste, and abuse. So the Senior Medicare Patrol is financed by HHS under the Administration of Community Living. And they basically work in three main areas. First of all, they conduct outreach and education. So they go around and gather individuals and provide presentations to educate about Medicare fraud, waste, and abuse. Since the creation of the program, they have they have reached more than 30 million people through their education activity. They also engage volunteers to help with fraud, waste, and abuse. And I think so far they have engaged over 5,200 volunteers nationwide to help. And they also get complaints and they help about fraud, waste, and abuse. And then they help the individual report those complaints or those concerns about fraud, waste, and abuse. The SMP program is in each state, including DC, Puerto Rico, Guam, and the Virgin Islands as well. We encourage you that if you have any question, or if you like to request a presentation or help with the fraud, waste, and abuse operation through the Senior Medicare Patrol, to call their toll-free number or to visit the website at smpresource.org. We also have a publication, the CMS publication number 11610, which provides some basic information about to help the individual protect the program through fraud, waste, and abuse. One of the things that publication focuses on is in the 4 R's, which is record appointments and services. And what this basically means is that asking the individuals to keep track of the doctors that they're going to see. And then when they receive the Medicare explanation of benefits, to go ahead and review to make sure that they are billing for the services that they were there to receive. And I was talking about upcoding earlier on the stuff, and that's one of those things that happens a lot, that the provider end up for billing for higher services that the individual receives. So it's important to review the explanation of benefits and to go ahead and call Medicare if they see any discrepancy in between the service they got and what it was billed to Medicare. And of course, report any suspected fraud. And remember to protect their personal information is the most important part in fighting fraud, waste, and abuse. Because once a fraudulent individual provider get a hold of the individual's information, it create the conditions for fraud, waste, and abuse to happen when they have access to that information. Now, next, we're going to go through some program-related resources. So we learned a lot throughout these 2 days. So it is a lot of information, and we're all only able to go through some basic information. So of course, this is not designed to cover each and every instance that you may come across with regards to the program. So it's important to know where those resources are for more information. So the first resource that I wanted to call to your attention is cms.gov. And this is basically for you, our partners. You will find information in there, all of the information that we talked about today. There's cms.gov. You will find the Medicare claim processing manuals. You will find Medicare publications and specific and detailed information about how Medicare goes about paying claims, services that are covered by Medicare, coordination of benefits, Medicare Advantage, Part D, and so forth. Medicare.gov is basically for people with Medicare. So this is a consumer-friendly website designed with basic information designed to help people with their questions. They can go there to compare Medicare Advantage plan, Part D plan, and even enroll in those plans. Medicaid.gov is actually for information about Medicare, and this is also for consumers. InsureKids.now.gov is for information with families with children about coverage that exists for those for families and children that may not be eligible for Medicaid. The next slide shows healthcare.gov, which is for information about the health insurance marketplaces. This is for the general public or for the consumers. Now for partners or for you, we have marketplace.cms.gov. You will find in there also a wealth of information or technical information about the health insurance marketplaces. We have also publications in there specifically for partners which have more detailed information that you would find on the healthcare.gov. Socialsecurity.gov also offers information about qualifying for Social Security benefits, including Medicare benefits, and you also will be walked through if you wanted to enroll in Medicare online. Socialsecurity.gov would have that information. We'll walk you through the process in doing so, and applying for low-income subsidy, as Sylvia mentioned. Regulations.gov is the federal regulation website that you can go in there to find if there's any regulations in the making, out for comments and such. And of course, we have the electronic code of federal regulation, which I mentioned when I was talking about Medicare secondary payer provision, which is under, in fact, almost all of the provisions in Medicare are under 42 electronic code of federal regulation. So you can go there to see where the laws are codified in regulations.
Great. Thank you so much, David. Great information, and brings us to a close for our day 2 of Understanding Medicare. Thank you so much to Kim, Sylvia, David for co-presenting, and for Joe and Melissa for the technical assistance. We will remain in the webinar room for a few minutes to keep answering some of the Q&A questions that we haven't gotten to yet. If we don't answer yours, you can always feel free to email us at training@cms.hhs.gov, which is on your screen now. And again, thank you so much for joining us and hanging in there for the webinar today. Enjoy the rest of your day. Thank you.